In this video, I'm going to answer the most common questions I get asked about knee replacement surgery. I'm Matt Segwa, a doctor of physical therapy, and by the end of this video, you'll have a better understanding of what recovery will be like and what to expect after having a total knee replacement. What symptoms should you expect? So after total knee replacement surgery, the most common symptoms that you're going to have with a lot of other joint replacements are you're going to have a good amount of edema, so a lot of swelling around the whole knee joint. So that's the front, the sides, and the back. And with that swelling, because it's going to be so significant, it can travel down the leg. So it's very common that you'll see swelling around the calf and down towards the ankle and the feet and toes. Additionally, you'll also have some bruising around the knee. Sometimes that can be behind the knee, but sometimes you'll see it in the front of the knee as well. And in terms of pain, you will have post-operative pain at the knee joint. So specifically, if you're weight bearing, so when you're putting weight and you're standing on that leg, you're going to have some discomfort initially, as well as after the surgery, we're going to work a lot on trying to regain a lot of the range of motion that's going to be lost, especially because you're having so much swelling in the knee. So once you get to bending the knee and trying to straighten the knee as much as you can at those end ranges, you're going to have knee pain as you try to regain that range of motion back. So swelling, bruising, and pain with weight bearing and when you bend and straighten your knee are very common symptoms to have after total knee replacement surgery. When do you start physical therapy? So just like other joint replacements, especially like the hip, physical therapy is typically starting the day of the procedure. So they're getting you up the same day at the hospital or at the clinic where you're getting the joint replacement. They're getting you up on your feet, so then you can discharge typically same day as long as there's no complications or anything. And then once you're home, usually you'll have home health physical therapy come to you to get you started on some of the exercises and the early rehab that you need in terms of working on regaining range of motion, minimizing the swelling and edema, and being taught the correct mechanics of how to maneuver in your home, whether that's in and out the bed or going up and down a few stairs in your home. So physical therapy starts like right away, typically same day as the surgery. When can you return to driving? So getting back to driving, the earliest that you can go back is typically 4 to 8 weeks, and you're going to need clearance from the orthopedic surgeon because then you're going to have to typically be discharged from any narcotics, as well as having a certain amount of range of motion and strength with that knee. Obviously, the timeline is a little sooner if the knee replacement is on the left leg, but if let's say it's on the right leg for the knee replacement, it's no sooner than 4 to 8 weeks, just so you can hit those benchmarks in terms of the range of motion, the pain, and the strength to be able to move your leg for the requirements of driving. So 4 to 8 weeks is the soonest that you'll return to driving. What equipment do you need? So in terms of any like supplies or equipment, typically insurance, and once you get discharged from the hospital, you're going to be discharged with a walker. Usually it's a front wheeled walker, so a walker with 2 wheels in the front. And then once you're home, sometimes they'll send you home with an ice pack, but you definitely want to have some sort of either an ice machine or a big ice pack, and having multiple is going to be very helpful for the knee replacement because you're going to be trying to control a lot of that inflammation and swelling very early on after the procedure. So once you're icing initially at home around the knee, you're going to be doing that pretty much throughout the day, like all day. So as one ice pack gets warm and loses the cold temperature, you're going to want to switch that out very quickly versus having to wait 30 minutes to hour for that same ice pack to get cold again. It's kind of wasted time. So the more effective you can be in terms of always having a few ice packs in a cycle, so then you can always switch out one that's warmer for a fresh one that just came out the freezer. So having multiple ice packs is going to be very beneficial. Like I said, typically you'll be discharged with a walker, At some point, you may need some kind of a cane, but that's not the priority right after surgery. And in terms of equipment, you're not going to need bands or any weights that first month after the knee replacement. So, walker and some ice packs, a few ice packs would be best. How long will I need to use an assisted device? So typically for your walker that you're using after a knee replacement, 3 weeks is the goal that we want to discharge you using that walker, but you're going to have to meet physical requirements. So you want to have full knee extension, or essentially where you can straighten out your knee without pain and good stability before we can discharge you from an assisted device. So 3 weeks is the goal, but for some people it does take longer than 3 weeks before they can be totally off using that assisted device. Can I return to playing sports after surgery? So this is going to depend on the specific sport that you're returning to, because typically plyometrics in general, where there's a lot of jumping and landing, those are, you usually want to avoid those activities after a joint replacement. So whether that's the knee or the hip, in terms of the research, the integrity of the joint replacement is kind of uncertain with high impact sports, but there are criteria that we aim to meet to get you to return to certain sports. So for example, one, you want to be able to have at least 80% of strength for essentially all the major muscle groups of your leg. You want that to be 80% at least of your non-surgical side, right? So if you had surgery on your right knee, you want to have the quads on that right leg at least 80% of the strength that you have on your left knee, just so that symmetry wise, it's your surgical side is capable of handling similar loads as your non-surgical side. So then you reduce the amount of compensation, and you also want to make sure that you did achieve full normal range of motion at the knee joint. So essentially it's matching how much it can bend and straighten compared to the non-surgical side. So you want that to be completely even to be safe to return to sports. Now, it's a lot easier to return to sports like cycling and obviously swimming, or even like table tennis, some sports that require less jumping activities, even like sometimes tennis and like pickleball can be easier sports to return to versus volleyball and basketball. But I have had patients who had knee replacements and were able to eventually return to basketball, for example. So it is possible. It just takes longer periods of physical therapy to ensure that you're regaining full range of motion and very normal strength capacities on that surgical side. If you recently had knee replacement surgery, this next video might be helpful as I demonstrate common exercises often used in the first 6 weeks after knee replacement surgery.